Caring for a gastrostomy tube after 6 weeks is very similar to the first 6 weeks. General care remains the same. It is important to keep the site clean and dry, which includes washing the skin around the tube with soap and water and drying well. There are several types of dressings that can be used to protect the skin from moisture. The tube should be rotated twice a day. The tube should be routinely changed every 3 months. You will be instructed how to change the tube at your post-operative surgery clinic appointment. To exchange your gastrostomy tube, you'll first gather your supplies. This includes water, replacement tube kit, and lubricant. Connect an empty slip-tip syringe into the balloon port labeled BAL on the G-tube in your child's abdomen. Pull back on the syringe to remove the water completely from the balloon, collapsing it. Next, you want to pull the button directly up and out. Apply a small amount of lubricant onto your G-tube. Draw up 3 to 5 milliliters of water into a syringe depending on the instructions on the box and the size of your button. Gently insert the new G-tube into the site and inflate the balloon with the new water using your syringe via the balloon port. The G-tube should feel snug but not tight. Connect your extension tubing and attempt to aspirate stomach contents into the tubing. This verifies the gastrostomy tube is correctly placed into the stomach. If you are unable to aspirate gastric contents initially, reposition your child and try aspirating again. If you are still unable to aspirate, wait 5 to 10 minutes and attempt again. If these attempts fail, proceed to the hospital for additional studies to help confirm or troubleshoot placement. If the gastrostomy tube accidentally comes out after 6 weeks, it should be replaced with the same size tube. This can be done at home. If you are unable to replace a new tube into the existing site or aspirate stomach contents, please come to the emergency department. The balloon will need to be checked weekly to ensure there is an appropriate amount of water left inside. This prevents the tube from leaking and becoming too loose or too tight. Do this by holding the button against the skin and withdraw the water from the balloon, being careful not to remove the gastrostomy tube. Replace the water into the balloon port to secure the button, making sure that the button is snug but not too tight against the abdomen.